the series, you should watch them. This is a continuation of all the content related to musculoskeletal to help you master your NCLEX. Before that, we have two questions just to give you an idea. After the lecture, we'll come back for it. And this is educating a post-menopausal client with their osteoporosis about lifestyle changes. Which of the following statements by the client indicate understanding of the teaching? Look at it. And this is reviewing discharge instruction with the client who has recently prescribed what alendronate. Do you know, recognize this medication is a bisphosphonate for osteoporosis? Which of the following statements by the client indicate the correct understanding of how to take the medication? You should be able to answer this question after the lecture. It's a quick lecture of straightforward content you don't need to memorize. What is osteoporosis? This is a condition characterized by decreased bone density. That means there's lack of mineralization of the bone, and that will cause the bone to be brittle, that it can break easily, and it's due to imbalance in terms of bone absorption and breakdown. The most common cause is found in postmenopausal people because of lack of estrogen, but men too can get it if they have other conditions, lifestyle changes, and medical history. The risk factors is straightforward. There is some risk factors you can change. There's some you cannot change. Those you cannot change is called more non-modified changes. And those are your age. You can't change your age. Gender, you can't change who you are. Ethnicity, you can change where you're from. And family history, if it's in your family, you get it. So that's non-modifier. But the modifier one is your lifestyle, what you do. If you have low calcium, low vitamin D intake, and you don't move, sedentary lifestyle, if you smoke a lot as a female and you drink a lot and you use steroids, these are all risk factors you can modify that will prevent you from getting osteoporosis. There's some other conditions that also can do that. Hyperthyroidism. Hyperparathyroidism is related to calcium metabolism and rheumatoid arthritis. These are common signs and symptoms that can risk factors that you should know. How would they present? Most of the patients you don't know, you can't tell if they have osteoporosis. Some will come in with fracture though, they fell and things that they fell, and most average people will not have a fracture without fall, but these people will have a fracture, right? They may present, okay, all of a sudden they're losing height. You're not supposed to lose height, but these people will come in they've lost certain amount of height within a short time, or they have kyphosis, where the spine is curved certain way. These are all certain signs and symptoms to tell you that these people may be having osteoporosis. How do you know? You got to test for it. What kind of test? We call it DEXA scan, dual energy X-ray absorptive metrography. This is usually a study that is used to assess and is very diagnostic. It tests for bone density, and you're looking at a certain percentage of the bone that is mineralized or not mineralized. You also have to assess for risk factors like what kind of diet, the activity level that is causing this problem. Most of the time when it's diagnosed, you want to increase their calcium intake. So because it's needed for bone mineralization. So you increase them, tell them to increase calcium intake. Wherever they're going to get it from, you have to teach them, like dairy products, like leafy vegetables, vitamin D, exposure to sunlight, or any 44 cereal or anything like that. You have to know how to teach them how to take calcium. They may need 1,000 milligrams of calcium or vitamin D. The key aspect is calcium, anything greater than 500 cannot be absorbed easily. Therefore, if you take in 1,000 milligrams of calcium, you should tell them to take it twice a day. If you're taking 500 milligrams of calcium just once a day. And then remember, vitamin D is used, vitamin D is necessary for absorption of calcium, but vitamin D does not need calcium to be absorbed. Once again, to absorb calcium, you need vitamin D, but to absorb vitamin D from your GI tract, you don't need calcium. Weight-bearing exercise is good. This also helps with the mineralization to teach them how to walk, jogging, resistant exercise in the gym. Of course, they need to stop the drinking and the smoking. And then yeah, and ensure that they strengthen their body, prevent fall, and then guide against them from falling. Like I said, source of calcium is very important to teach them, like dairy product, like egg, milk product, yogurt, leafy vegetables, right, and fortified food, orange juice, cereal. You can also take in some vitamin D. These are the source of vitamin D to provide 600, 800 uh, um, units of vitamin D that they need, like salmon, fatty fish, fortified milk, sunlight, of course, will give you vitamin D. And some protein also has some vitamin D in it. What is the pharmacological management? You have to know the bisphosphonates and how to take it. They have last name of what we call adronate. So alendronate, residuonate. So this is a common medication you should know. And they are the first line therapy for management of osteoporosis. The key aspect you both like is how do you take it? You take the medication, remain upright for 30 minutes, full glass of water, and then empty stomach as much as possible because it causes esophageal irritation. If you don't have it, they will give you the Cephin, lorazepam. The lorazepam, they like estrogen modulators. Some areas they act like estrogen, some areas they don't act like estrogen. And they mimic estrogen to maintain both strength. That's why it's very common in postmenopausal because of decrease in um, estrogen level. Calcitonin also is used as short-term. It can prevent bone absorption. And of course, hormone replacement, when you replace it, all of you know there's a risk factor associated with it, like DVT and breast cancer and other things, but you have to know what you're preventing. And finally, patient education. You emphasize the importance of adherence into the medication, taking their medication, lifestyle modification, following their group exercise, and adhering to the risk factors that you have instituted to prevent worsening of the condition. So, in other words, a patient is educating a postmenopausal client with osteoporosis about lifestyle changes which of the following statement by the client indicate understanding of the teaching? So I can drink soda daily because it does not affect my bone. Yeah, you should not do that. I should include weight-bearing exercise like walking in my routine. That's good. It is okay to smoke. It's not good. I don't need to worry about getting enough sunlight since I take calcium. You are not true. Vitamin D is needed for calcium absorption. And this is reviewing discharge instruction with so the right answer for that one is set to B. And this is reviewing discharge instruction with the client who has recently prescribed alendronate for osteoporosis. It's a bisphosphonate. Which of the following statement by the client indicate the correct understanding of how to take the medication? So I should take the medication with breakfast to reduce stomach upset. You should not take it with anything. I need to take the pill with a full glass of water and remain upright at least 30 minutes afterward. This is to prevent esophagitis. That's a good answer. If I miss a dose, I can take two tablets the next day to catch up. No, you should continue with the regimen. I should lay down after taking the pill to avoid feeling dizzy. It does not cause dizziness. You're supposed to remain upright for 30 minutes after taking the medication. This is the end of it. I know you learned something. Take care of yourself and osteoporosis down.